Hello, my name is Grant Murray, Research Assistant for Northern Alliance. This recording will provide a brief overview of the Scottish Public Health Observatory tool. I'll aim to provide a tutorial which should give you an initial understanding of how to use and navigate the tool. In addition, I'll reference some other sources of health and wellbeing information you can access and hopefully benefit from. The online tool is a free, open access site maintained by Public Health Scotland and pulls in a variety of data sources and presents them in an interactive fashion. It has a range of indicators, some of them relevant to children and young people, others related to other people in the population. I'm now going to go through the tool and provide you with a bit of a tutorial. By all means, feel free to access the tool using the link I've provided at the bottom and work alongside me as I go along. So, if you've copied the tool into your browser, you should come to this landing page here. Now, I'm interested in just having a little overview, and for this I'm going to go to the profile summary. Now, just to get things set up, I'm going to follow the steps outlined in bold. So I'll firstly set my geography level, which will be a council area, because I'm interested in the local authorities. And if I open this up here, it will have the list of local authorities to choose from. And I'll just choose Highland. From here, I'll then select the profile, which is just a suite of indicators, and I'm going to go with children and young people's profile. After that, I'm just going to stick with the area comparison. You can select time, but I'm just going to stick with area, and this comparison area is Scotland. And I'm going to stick to the snapshot view because I'm just curious about the overview of indicators just now. So if I scroll down and view the children and young people profile, we'll see a range of boxes in which these are the indicators, and they themselves are listed under the Shinari headings. And you can see the colours that are coming up as well. And there's a key just up here which points out what each of those colours means. So as you'll see, there's a number of indicators. If I just scroll down and go to child dental health, which you see on the left here, and if I hover over that, we can see that the area statistic is 77.8 and the comparator is 72.9. This is in reference to 2018-19 and it's a percentage. Now, of course, that's really interesting to see because it's blue, it's higher than comparator, it's better than comparator. But still, you might be asking yourself the question, what does that mean in terms of the measurement definition? And thankfully, we can scroll back up to the top and look at definitions. And if we just briefly scroll down, we should see our definition there. So again, looking at this information specifically, we see that the number of, or the percentage, of primary 7 children receiving a letter C, no obvious decay experience, is better than the comparator, which is Scotland. Now, that's really good for, again, seeing the overall snapshot of the indicators within this profile, but I'm also quite curious about the trend data, the data over time. So what I'm going to do is I'm going to go up to this trend box just on the top next to summary. And again, we've got an indicator already there, but so we want to change that back to the primary 7 dental health data. We can again scroll down the list of indicators, and it's quite long. So what I'll do instead is I'll hit backspace and just type in some of the keywords. So dental health, and obviously we've got 2 indicators with the word dental in it. So I'll go child dental health in primary 7. We've already got a black line for Scotland in there that we can select our council areas. And then this occasion, I'm just going to go with Aberdeen City. I could have more in there if I wanted, and you'll notice with the comparison, we've got different colours for each area. And if I hover over, I can see the figures over time for this specific measure. Now, I can toggle off the Scotland comparison if I wanted to. And thankfully, what's another really nice feature of this, for some data points and data sets, we can sometimes look a little bit deeper into a local authority and look at some of those communities that make that area up. For that, we need to scroll down just a little bit and look at the health and social care partnership. So if I've already looking at Aberdeen City as a council area, it might be worthwhile looking at it within and looking at the intermediate zones, in which we click on them and we can see a number of intermediate zones. So again, we've got Cooter here, and again, we may have a school that serves the area of Cooter, and this might be particularly useful for them. And again, you can see the trend in Cooter relative to Aberdeen City as a whole. So it would appear here that particularly around 2013, 14, 2015, 16 and a little bit beyond, there was a higher proportion of children with a particular dental health banding than the rest of Aberdeen City. Now, of course, that might be good news, but it's also worthwhile just keeping an eye on that in case there's any changes, and you might want to think about if there's a need to intervene there. Alternatively, you might look at other areas as well and think if there's areas that could be identified and targeted for support in respect of child dental health. And as you can see, we can plot more than one area as well, which can give you that insight. I'll just show you one other indicator within here. So if I have a look at child healthy weight in primary one, so again looking at a different stage, and we can plot more than one council, but I'll just want to show Aberdeenshire. So I'll remove Aberdeen City, and again we can see the black line for Aberdeenshire, but you can also still see the areas within Aberdeen City. Now, obviously, to change that, we need to select the Aberdeenshire Health and Social Care Partnership, and then start to select slightly different areas. And we can see, again, variation within Aberdeenshire areas. So again, we can see Kemney being slightly below in 2018-19 in terms of child healthy weight in primary one. And again, we can see that Mearns, South and Benham, again, round about the same as the Aberdeenshire figure, just a little bit below, but not far off it. So again, it might be worthwhile if you're involved in that area, and again, if there's any further work to probe and understand why that trend's there and the possible means of potentially intervening, then that might be something for you to consider if you're in that community. And now the last section I'm briefly going to show you is the inequalities section. So again, if we just go through the steps like we did before, and again select council area, and this time I'll go for an Islands Authority, I'll go for Shetland. And my indicator, I think I will go for uptake of HPV vaccine in third year girls. And again, our time period's there, then we can change that. Now, interestingly, if you listen to my previous presentation on the local data for local improvement in the use of local indices, this might look quite interesting to you, but obviously we've got the option to flick between the local indices, the local quintiles, and the Scottish quintiles. So obviously if we go to Scotland and we see that there's only quintiles 2, 3 and 4, that's because there aren't any quintiles 1 or 5 in Shetland. But if we look at the local quintiles, we can see that we've got that distribution between 1 and 5. And again, it just allows you to desegmentate the population and subsequently then give you a bit more of an idea on particular groups who may not be taking up the HPV vaccine, and perhaps give you a little bit of an idea of how to target them. And of course, if you ever want to download any of this data, you can visit this tab here and again enter your indicators by geography and things like that, and it'll export that as a Excel file, which will allow you to do any further analysis. So that's a quick whistle-stop tour of the Public Health Profiles tool. With that being said, I'll point you in the direction of some other health and wellbeing related information that you may find particularly helpful. So the Scottish Schools Adolescent Lifestyle and Substance Use Survey, sometimes referred to as SALSUS, is quite a broad national survey. It's fairly comprehensive, covering a range of themes, and interestingly, the national reports pick up on these themes and segment them by socioeconomic status and various other factors, and they can often provide quite useful insights in challenging any misconceptions. So again, I thoroughly recommend people to look them up in detail using the links that I've provided you with you there. But equally, if you're interested in your more local reports, the local authority reports are there. And again, the links are there for you to enter in your browser, and you should be able to view the reports detailing the views of young people within your local authority area around various items related to drug use and various other factors. So, just in summary, the Scottish Public Health Observatory Profiles tool is an extremely useful tool, in my opinion, and it can allow you to view other pieces of information at different levels, whether that's at a council level or indeed at a community level. I should just advise a little bit of caution, as some of the data can be quite sensitive, touching things like mortality rates, and it's just something worthwhile bearing in mind when you're viewing that information, that it can be a little bit sensitive. And hopefully by using things like these tools, and again using the Solstice data as well, it should hopefully provide you with that holistic overview of health and well-being, and how important that is to ensure that we can get it right in respect of child and family health, as well as at different stages, and we can hopefully try and gain that understanding so that we can intervene appropriately and build up that basis of working. So I hope you found that helpful. My details are there if anyone has any questions or queries, or wants to just have a chat about using the tool. I've also got a QR code there that you can scan with your mobile phone and provide me with a little bit of feedback and how I can make this presentation a bit better. And finally, I'll hopefully be discussing kind of this tool and various other aspects of health and wellbeing data on the 29th of this month with Alison Thompson. I really look forward to anyone who will be visiting that discussion, and happy to take any questions there. So thanks very much for your time.